Welcome, everybody, to the workshop today. We are going to be focusing on the topic of myths and facts of seasonal affective disorder. And of course, like always, if you want to receive Healthy Lifestyles points for attending today, there is a link in the chat box to sign in. And I'm going to turn the time over to Hannah Van Alstine, and she will introduce herself and get us started.
Hello, everyone. My name is Hannah Van Alstine, and I am a clinical social worker at St. Mark's Hospital in the behavioral health unit. And like Sadie had said, we're going to talk about seasonal affective disorder and how that plays a role in with what's going on in the world right now with COVID and all of that. So I appreciate the opportunity to talk to you guys today. And I wanted to let you know that there is going to be some construction noise, so I apologize for that. But I will try to, it shouldn't be too much of a distraction. So I will share my screen out here. Okay. Okay. Can everyone see my PowerPoint?
Yes, we can see it.
Okay. Perfect. Okay. So like we had said, we are going to be talking about seasonal affective disorder. And before I start, I wanted to talk about and make sure that I disclose that this is not me giving anybody a diagnosis. This isn't any clinical advice or anything like that. It's just providing you with the information so that if you start to notice some of these symptoms, to talk to your doctor or your therapist to go forward with that. So you might be experiencing seasonal affective disorder, also ironically called SAD. But during the late fall and the winter, if you're noticing that you're craving sugary and fatty foods, if you're sleeping more than usual, withdrawing socially, and then also have some symptoms of depression, which could look like unmotivation, having some thoughts of suicide, maybe some self-harming behaviors, having a feeling of hopelessness or that things, are pretty hopeless, not going to get better, as well as feeling depressed most or all of the day. And I want to clarify that this is only during that late fall, during the winter period. There's also a type of seasonal affective disorder, which we'll talk about a little bit later, that does not occur during this time. But for the majority of people experiencing this is when it would occur. So seasonal affective disorder is not a clinical diagnosis on its own. It's actually a type of clinical depression with a seasonal, again, like I said, it's during those times of late winter, late fall, early winter, late winter, when you're noticing that these symptoms are occurring. And that's what differentiates it between clinical depression or major depressive disorder, is that it's not an all year round episode or occurrence. It's just during those time periods. In order to meet the criteria for SAD, you have to have at least 2 episodes during that season. And what that looks like is 2 depressive episodes, which equals to about 4 weeks total. So one depressive episode, in order to meet clinical criteria, is having at least 4 of the symptoms of depression for 2 weeks during the entire 2 weeks at that time. So if you are having at least 4 weeks of these symptoms, the unmotivation, the hopelessness, craving sugary fatty foods, things like that, withdrawing socially, then you might be experiencing SAD. About some depressive disorder statistics. So it's important to note that depression is very common, which I'm sure a lot of you know. It's more common than we think. So it's the leading cause of disability in the United States for people who are 15 to 44. So I feel like that for me, when I found that out, that was a pretty alarming statistic, because that means that enough people are experiencing depression and not to the point where it is considered a disability. So that is something that I think it's important to be aware of. And as I just was thinking about it, if you have any questions, I plan on answering all of the questions during the end of the presentation. So I apologize if some of you have already put in questions to the text box I can't see, but I will make sure to address all of the questions at the end of the presentation. And also wanted to mention I have a couple questions during the slides. So if you wouldn't mind providing the answers in the text box below, that would be great. But getting back to it, so major depressive disorder affects more than 16.1 million American adults, or about 6% of the population, people who are 18 or older. So that doesn't even, hit the point of episodes that are being experienced by people under 18, which are also pretty prevalent as well. And I also found in Mental Health America 2021 statistics, they ranked that Utah has the least amount of access for the most amount of mental illness episodes in the United States. So we are ranked last, unfortunately. So that's something also to be aware of too, is that people who are experiencing mental illness in Utah are not able to get access to care as often or as much as they should be able to. And more statistic is that major depressive disorder is mostly experienced by women. That does not mean that any other genders are not experiencing depression, of course, but that is found to be true, is that women experience depression more than often than any other genders. All right, so myths and facts, since that's the title of the presentation. So what SAD is not? So SAD is not the winter blues, and so the two are not the same. The winter blues is, the typical, I'm feeling less energetic, maybe a little bit down because we have that less amount of light. We're not able to do as much physical activity maybe as we usually do. Getting outside isn't as convenient. So the winter blues are not meeting clinical criteria. So if you're experiencing that, that's not something to be alarmed about. That's totally normal. But if you are experiencing SAD, which we'll talk more about what that looks like, that is something you might want to talk to your doctor. Also, like I spoke about earlier, SAD does not just occur during the winter months. There's a very small portion, I believe it's 1% of the population that are experiencing SAD that actually occurs during the spring and the summer months. But weirdly enough, they don't have the same symptoms as someone who would be experiencing them during the winter and the late fall. So these side effects or symptoms look very different, and we'll kind of touch on those, but that is experienced only with about 1% of the people experiencing SAD. And then lastly, another myth is that only women can experience SAD, which of course is not the case. Anyone could experience SAD, unfortunately, and it's something definitely to be aware of if you are experiencing it. So I wanted to touch on the numbers of what SAD looks like in the United States and also worldwide. But I'm not going to read about all of these statistics. Of course, I will touch on the ones that I thought were pretty important. So 55% of people have family members with a depression issue. So again, people who are experiencing this are not people who have major depressive disorder typically. It's just during those peak winter months. So people who have family members, the majority of them have family members who have depression. And there are 350 million people worldwide who suffer from depression, which is a big number. It's very, very prevalent. And it keeps going up, unfortunately. And with COVID and all of the things going on, the numbers have risen also. So we'll also talk about what that looks like too. And then I wanted to talk about this as well. Fewer than 40% of people who need help actually seek help, which there is a mental health stigma definitely in the world. And unfortunately, people don't feel as comfortable talking about mental health issues. And so that's why it's important to learn about, SAD and different mental health issues and things to look out for, so that when you are experiencing this, that you feel comfortable talking about it with someone and knowing that there are people who can help as well. And then 50% of people ages 12 to 17 said that depression symptoms were why they sought help. So with this, disorder or offshoot of depression, people are going in for treatment because of the depression, um, and not so much like the weight gain or the sugary foods, things like that. It's just those depressive factors. So, what causes SAD? The biggest theory or the most common theory of why SAD occurs is because of the lack of light that we are getting. So, lack of vitamin D, which is very important to mental health. So, not having that natural light can really make people feel, in general, of course, the winter blues, like we talked about, that can happen, of course, but it can get to the point where people are experiencing a type of clinical depression. So, SAD happens because of less light in during the months of winter and late fall. It doesn't, of course, it doesn't account for the times or the individuals experiencing it in the spring and summer. That is not so much known about or why that occurs, but for this type and for the most common type, that is why SAD occurs. And who are at risk? So women, people between 18 and 32, as well as people who have family members with major depression disorder. So that is, the people at risk currently for this disorder. Okay. Not sure. Sorry, something is going. I can fix it. Okay. All right, so I have a short video of what SAD looks like to give you kind of more of a visual, things to look out for if you are experiencing any of these. So I'm gonna exit here. Okay, watch this video.
Hannah, the video is not playing on our end. Is it playing for you?
It is. Let's see. Okay, let me try something else. Can you guys see it?
Yes, now we can see the YouTube
Okay,
screen.
perfect. Replay this for you guys. Okay.
I'm
Sounds
sorry to
like
interrupt again. It looks like we're
no,
not getting
yeah.
audio.
I just saw that. Let's see. I wonder why. I do not know how to see. Hmm. I don't know if this will work. I'm gonna try. Guys, I apologize. Stop sharing this for a second. Okay. Apologize about this. I'm gonna try to just put the link in so that'll see if that will work. Okay. Hopefully this will work. Let me know if this isn't working again. And okay, I'll start it again.
No, I'm still seeing the screen where it's the shared web browser, the WebEx
Okay,
address.
okay. See if this would work. Well, I apologize. I don't know how to, since it's shared on my end, but I don't know why the audio wouldn't be working. Um, so I might have to.
Oh, it looks like Kim just mentioned that movies do not work on this for whatever
Oh,
reason.
they
I'm
don't.
sorry.
Okay. Oh, no, that's okay. That's good to know. So I apologize about that, you guys. So I will share just my presentation again. So I will just kind of talk a little bit about what the video talked about. Okay, so back to the slide. So what the video talked about and what things you should notice or look out for with seasonal affective disorder about if you're noticing that you're not enjoying the activities that you normally enjoy, if you notice that you are, again, withdrawing socially, not reaching out to friends and family, which of course during this time is been challenging and been difficult, um, and much different than it ever has been in the past. And I definitely want to talk about how to do that. And also if you are noticing that you are sleeping throughout the day, kind of zoning out on TV, noticing that you have suicidal ideations, maybe some self-harming behavior, that is something you definitely want to talk to your doctor about if you are noticing any of those symptoms. So SAD during the spring and summer months, and like I said, it's not very type of SAD occurs, but I definitely wanted to touch base and talk about it a little bit because of course, it does happen. So the symptoms for this type of seasonal affective disorder are insomnia, weight loss, agitation, and anxiety. So if you're noticing that, again, during 2 full weeks and two separate times of those 2 weeks of those different symptoms, that is something you might want to, again, talk to your therapist, talk to your doctor about because although it doesn't happen very often, it definitely does occur. Obviously, 1% of people who have SAD do have this type of this disorder. So definitely talk to your doctor if you're experiencing any of those symptoms as well. So some unhealthy coping that I wanted to talk about that is common with depression, with SAD in general. So if you are noticing that you are increasing the amount of drinks that you have, so let's say you're a 2 drink a week kind of person and you're up to 5, and you maybe drink more often than you used to. If your drinking has changed, that is something to look out for the disorder, as well as substances. If you are noticing that you are using substances, or if you've had a history of using substances and you relapse, things like that, those are things also to pay attention to with um, red flags for SAD. And then the other one I wanted to touch base on is if you're not taking your medication as prescribed, or if your medication has changed, if you are taking your medication more. So let's it's a as needed anxiety medication, and typically you take it one time daily, and it's your doctor prescribed it for 3 times daily, and you're noticing that you are using it 3 times. That might be something to look out for as well. Self-harming behavior. So this doesn't just have to be cutting and burning and things like that. Self-harming could be as well looking like maybe you're picking your eyelashes out, or you're picking your skin, or if some people who are nervous, they'll dig their fingernails into their legs, things like that, or into your skin. So it doesn't just have to be cutting and things like that that we typically think of as self-harming behaviors. It can look as simple as just picking your skin and other things that are a little less severe. So that is something also to look out for as well. If you are sleeping all day, or if you're someone who is able to spring out of bed in the morning and you're not able to do that, and you've noticed for the last maybe week or so, 2 weeks or so, that you've noticed that you've been having a really hard time getting out of bed, not wanting to start the day, that's something that is a red flag as well. If you're emotionally eating, so when you get home from work and you're super stressed and you just, down in front of the TV and you finish off a bag of potato chips and think, oh, how did that happen? So that's something also to notice as well. Of course, sometimes this does happen and necessarily mean you are experiencing SAD, but it is something to look out for, definitely. If you're zoning in front of the TV for hours, and normally you're someone who typically doesn't do that, maybe someone who isn't, of course, watches TV, most of us do, but someone who is for hours a day sitting in front of the TV and not really watching or having motivation to get up, that is something that you might want to look out for. Not showering as often as you used to or getting ready for the day. I definitely want to talk about this one because, of course, with COVID, many of us are working from home and we stay in our pajamas sometimes for the whole day. If you're noticing that you're doing that and you're not showering, like you showered every day and now you're kind of showering twice a week, that's something to be aware of as well, because although we work from home, it is a sign that you may be experiencing something a little bit more severe than the winter blues, or you know anxiety due to COVID. It could be something a little more serious. So it's definitely something to pay attention to as well. And then withdrawing, socially isolating. I'm going to touch on this a little bit more throughout the presentation, but it is important to note that this is a sign of depression in general. But if you're someone who is super outgoing, has a group of friends, even if you're someone who just connects regularly with family and friends, and of course during this time it's very hard. But if you're someone who does this, this is something to pay attention to as well. If you're not responding to people's texts or you're not calling friends, family, that kind of a thing, that's something to be aware of as well. All right, so this isn't a video, luckily. So there are 3 different self-assessments, and I want to disclose prior to showing these to you guys that this is not a formal diagnosis. This is a self-assessment. These are 3 self-assessments you can use to be able to talk to your doctor if you're noticing any red flags. So I wanted to show them to talk to you a little bit about them. So the first one is called the auto-PIDS, and this one looks for your mood and kind of analyzes and assesses your mood within those prime SAD months. So, and determine if there is a pattern. So if your answers indicate that maybe you've had 2 separate episodes of depressive symptoms, then that's something you might want to look out for. Also, the auto MEQ, this assesses your circadian rhythm, because along with sleeping too much, sleep quality is affected by SAD as well. So if you're not sleeping enough, or if you're sleeping a lot, that is something to definitely to look out for. And this assessment will kind of help you to examine, if you are experiencing maybe less quality or too much sleep, to talk to your doctor about as well. And then the last one is the auto-PSI, and this assesses the level of your depression. Again, not a clinical diagnosis. It's not a diagnosing tool. It's just something to be aware of, so that if it indicates that you're experiencing maybe some more severe depression or depression, you can talk to your doctor about that. And I wanted to show you the assessment website. Are you guys able to see this?
It's still in your PowerPoint.
Okay. So my assumption, okay, so I'm gonna share this. Okay, can you see it now?
Yes.
Okay, perfect. So the website is Center for Environmental Therapeutics. And this, like I said, these are free assessments that you can use if you are concerned, maybe you're noticing some of these symptoms. Um, if you are concerned, to kind of self-assess yourself and talk to your doctor as well. So the three different assessments tools that you can use to kind of see if you're experiencing anything that's a little more severe than the normal winter. Move back to the PowerPoint. Are you guys able to see the PowerPoint?
Yes.
Okay, awesome. Just want to double check. All right. Okay. So the treatments for SAD, typically that people have or do with their doctors and therapists and psychiatrists are light therapy, talk therapy, and antidepressants. So light therapy is also called phototherapy. So how it is typically done is that you have a light therapy box. So in the graphic, you can kind of see the woman reading. And that light therapy box is there to mimic natural light in the morning. So in the winter months, we obviously have a definite lack of light in the morning. So this is supposed to be the substitute for that so that your body can wake up a little bit more and it increases your sense of energy and helps with motivation, things like that. And it's usually used daily for 5 to 30 minutes. But of course, that depends on you and your doctor and what you guys decide. But that's the typical amount that people use it. And it's usually right when you wake up in the morning. So typically, your doctor will have you go wake up, maybe read something, make your coffee, like that, and use it so that it can mimic that morning light that we don't have so much in the morning. And again, that's shown to be effective to help ease those symptoms of tiredness, wanting to stay in bed, and increase your energy so that you don't feel so sluggish throughout the day. So then there is talk therapy that is typically in the form of cognitive behavioral therapy. So cognitive behavioral therapy is generally a very fairly strict, regimented type of therapy, and it helps to cognitively restructure your thoughts, as well as to confront those behaviors that maybe are starting because of seasonal affective disorder. So things like withdrawing socially, feeling hopeless in the winter, eating those snacks and things like that more than often than you usually do. That is something that you and your therapist could work together to kind of confront those thoughts and talk through what you're experiencing with SAD, with that hopelessness, unmotivation, things like that. So social withdrawing, and be able to kind of make a plan and how to go about regaining that again, and starting to do healthy coping skills to work with that. And it's very important to reach out for help and not to minimize your symptoms. I think a lot of us do. It's confusing whether it's seasonal affective disorder, if it's anxiety and depression due to COVID stuff and everything else that's going on. So I think regardless of whether or not you think you have seasonal affective disorder, if you're experiencing any of these symptoms, I highly recommend reaching out to your doctor if it's severe and you are getting concerned about depression and things like that. And then the last thing that typically is used with for treatment for this is medication to a psychiatrist and getting on those antidepressants in conjunction with therapy and light therapy is said to be, the best treatment. But of course, not giving you any clinical advice or anything like that. But that's just the most common way to treat this. And an example of an SSRI is Zoloft, for example. So talking to your psychiatrist about, if you're noticing that and maybe if medication would be helpful for you. Right, so I'm going to kind of move into coping skills and how, if you're noticing that you can do to help mitigate and ease those symptoms. And this goes for, major depressive disorder as well. So I hope this helps some of you help with your depression or things like that. So the first thing I wanted to talk about is self-soothing, and I'm not going to touch on all of these, but I did want to touch on ones that my patients, I tell people most to use during this time. So the first thing and the easiest thing that you could do to cope with whether it's anxiety or seasonal depression, just feeling down, is breathing consciously and trying a breathing exercise. So there are plenty of breathing exercises on the internet, and even as simple as just sitting and being aware of your breath, just counting your breaths is it's as simple as that. So kind of starting to become more mindful of your breath, how many breaths are you taking in, how deeply are you taking your breaths, how much are you letting out. That can help with centering yourself, grounding yourself, and kind of getting your mind off of those depressive thoughts and hopelessness thoughts as well. So that I think is the most easy and accessible coping skill or self-soothing thing you can do, because you can do it anywhere. You can do it at work, you can do it at home, you can do it at the grocery store, wherever you want to do it. It's easy to and accessible to do. Another thing I wanted to touch on is or just physical touch in general. Some of us, and maybe many of us, live from at home alone, and physical touch is not been as easy or as possible because of COVID. So something that you can consider doing is wrapping yourself in layers of blankets. There also are blankets that are weighted that you can buy that give you that sense of pressure or physical touch. This is just helps relieve a lot of anxiety and helps to increase your serotonin levels, things like that, so that you get rid of that feeling of anxiety or can help with loneliness, things like that. So it's something to self-soothe when you're feeling like you need a hug, essentially, and you can't really do that due to COVID. So that's a really good tool to use. I also wanted to talk about focusing on just one thing. So it's on the bottom left corner. It could be a noise, a smell, or sensation around you. So this helps to also ground yourself, become aware of your surroundings, and just make sure that you are being present and in the moment. Because right now with COVID and everything that we have going on top of depression, things like that, it's so hard to stay in the moment ourselves that time to just be sometimes. And so I recommend doing that if you're having that feeling of racing thoughts, things like that. Um, Something else that I recommend and talk to my patients about is trying a guided meditation app. And this is something that you can do it from home with your family, but it sometimes you can make it fun and things like that. But a guided meditation app, if you have the time, just taking that time to yourself, if it's even 5 minutes a day, to talk about and think about where you're at, what are your feelings, checking in with yourself. And I really like guided meditation apps for people who are new to meditation, because it's easy. It's hard to just sit there. As much as it seems like common sense, I'm just going to sit there and be aware of what's going on. It's so hard to just or not focus on other things. So a guided meditation app can be a really useful tool to guide you through a meditation and helps with thoughts and things like that, a little bit more easy to focus on. And then also wanted to talk about just standing up, shaking your body, and letting yourself cry if you feel it coming. So I think right now too, it's especially important to just letting yourself cry. And as as weird as that may sound, it's important sometimes to sit in the crappiness of what's going on, and it's hard to do, of course, because we're surrounded by there's a lot going on, and letting yourself cry can help you relieve that anxiety, relieve that tension, and just feel a little bit anxious throughout the day as well. But those are some of the self-soothing techniques that I recommend for my patients and talk to people about during this time and if you're experiencing any depressive symptoms. I also want to talk about depressive coping statements. So this is known as like positive affirmations, but they, as cheesy, I think sometimes they may sound, a lot of us don't hear positive things about ourselves, maybe. We don't think positive things about ourselves. Um, and we're so isolated, way more than we normally are, that we don't get to talk to people or we have a harder time talking to people um, who appreciate us and say positive things about us. So I wanted to go through these just as kind of an exercise to think about when you're having those negative self thoughts and things like that. So the first one, not all thoughts are true. My emotions do not define me. Not a weakness to ask for help. My current situation is not my final destination. This is just one chapter in my very long book, and I am worthy of happiness and trust in the future path. The one for me that resonates the most is that this is just one chapter in my very long book. So a lot, I mean, I'm those people too that sometimes it's hard to see the end in sight with COVID and with the winter months coming and all of the things that we have going on. So just realizing that right now is just one chapter in our lives, and that eventually, slowly things will get back to normal, hopefully, and we can connect with people the way we used to and go about life that isn't in such a stressful way. Another thing I wanted to talk about is making a coping skills toolbox. So what it is a you to keep things that can calm you down or make you feel relaxed in periods of distress, which I think we can all agree maybe that is a period of distress. So if you have everything in one place, it's a lot easier to grab and to go to. Just know where to find something if you are feeling A, B, or C. So, of course, different coping skills are used for different symptoms of depression or anxiety. Um, so, I'll kind of walk through a couple of these. We already touched on self-soothing and mindfulness, but talk about the other ones as well. So distraction. So this would be used if you have those ruminating thoughts of negativity or anxiousness, things like that, to get your mind into a different set, I guess, mindset. So it's not meant to, of course, heal from your anxiety or depression or work through it. It's more to just get your mind off of it in the present moment so that you can go about it, and hopefully it can get your mind off of it so that you can continue your day without having those thoughts. And if they do come up again, of course, going back to the distraction exercise. So different things that you can do could be puzzles or books, artwork, crossword puzzles, positive websites, positive affirmations, music, movies, just things to get your mind off of your current maybe negative or anxious thoughts. We talked about mindfulness. Opposite action is a DBT skill. So DBT is dialectical behavioral therapy, and it's the goal of this is basically doing the opposite of what you wanted, or the opposite of what your mind, I guess, says. So if you're in a sad place and you have a pretty negative mindset, I know a lot of us, when we're in that point, you watch sad movies or listen to sad songs, but opposite action tells us to do the opposite of that. So if you're feeling sad, watch a funny movie, call a friend and tell them about your day, things like that to get you out of that place so that you're not going to be stuck there all day. Also, and telling yourself something that you love about yourself or positive affirmations can be super helpful as well. Crisis plan, I wanted to talk about this as well. So it's have a crisis plan because, like we talked about, seasonal affective disorder can result in suicidal ideation. So that intent to kill oneself or having those thoughts can be obviously very dangerous. So it's important to reach out for help and having a safe. And with that safety plan, it's important to talk to the people who surround you to look for red flags. So if you tell a friend or a family member, hey, when I'm withdrawing, or maybe if I'm in my room all the time, or if I say I'm fine, but you can tell I'm not, please reach out to me and talk to them about that safety plan so that you won't be alone and have people who know what to look out for. Also, of course, talk to your psychiatrist, call a crisis line, things like that, so that you are in a safe place and get the help and support that you need in that time. And then emotional awareness. So, tools for identifying and expressing your feelings. So, that could look like journaling, that could be drawing your thoughts and feelings. Like if you draw, what does it look like inside my head right now? What am I thinking? What am I having? What does it look like? Those are kind of things to help you identify how you're feeling at that time, just to get you more in touch with your emotions. And then put all of that stuff together so you have an easy access to and whatever type of mindset you're in, whatever coping skill would be the best for you to use during that time. Okay, so I wanted to touch on Hygge and how this comes into play and why I think it's a really cool mindset and way to look at life, I guess. So, unfortunately, because we can't play a video, I'll have to kind of just talk a little bit about it. But Hygge is a Danish term and Finnish concept, and it can't be directly translated to anything in English, but essentially it means having a cozy space and feeling cozy and enjoying the simple things, which I think right could be really helpful for a lot of us, especially those of us who are really struggling with the social distancing, things like that, and being more isolated in your. So the Danish individuals and citizens are consistently ranking in the, I think it's around the top five happiest nations in the world. So they credit Hygge a lot to their, I guess, ranking as the happiest, one of the happiest countries, as well as they consider it part of their national identity. So they compare it to, as the U.S. considers freedom as part of our national identity, the Danish people view Hygge as part of theirs and credit it to why they are one of the happiest people in the world. So I think changing our mindsets to a more, I said Hygge friendly, but more of a mindset can really help us change the way we see winter and take care of our mental health. And I think the Danish people are onto something because they experience some pretty severe winters, a lot less sunlight than we have, much longer winters, and they are still, experiencing and are one of the happiest people in the world, one of the happiest nations. So I think to learn from them, and I wanted to share with you guys. And I don't have a video, but I can definitely talk through it as well. I wanted to also talk about this book. So, The Little Book of Hygge is Danish Secrets to Happy Living. So, it is written by Mike Viking, and he was the man who was going to speak in the video I was going to show you. But he has talked about Hygge and made it not just for the Danish individuals, but he made the book and it's translated into many languages, but so that the whole world can share and understand what makes Danish people happy and how they change their mindset to kind of cope with life and long winters and things like that. So I wanted to definitely talk about that book because it's great. So this is in the book, and it's what Mike Viking calls the Hygge Manifesto. So what makes Hygge? So the first one he talks about is atmosphere. So turning down the lights, lighting candles, and I'll talk about this more, but making your lighting at home cozy and not, of course we have, a lot of us have fluorescent lights at work, but when you go home, making sure that it's that dim lighting, that cozy lighting, which can help bring you into that mindset of coziness and, I guess, peace and comfort. He also talks about presence and how it's so important to be here in the moment and turning off our phones. I think with the world, the state of the world, a lot of us are tuning into our phones, social media, the news, things like that. And he talks about how important it is to make sure that we are tuning into ourselves and also just being present and with our family, our friends, whoever we live with currently, and really taking the time to spend with them. Comfort is another big part, and so making sure that you are taking a break and getting comfortable. So we talked about self-soothing with a blanket, wrapping yourself in a warm blanket, putting on when you get home from work, putting on some comfortable sweatpants, things like that that can kind of get you into that cozy mindset. And I'm not going to talk about all of them, but he also talks about gratitude and being grateful and thinking about the things that we're thankful for in our lives. So whether that be a friend, or I'm grateful that I have the time to spend with my family, or I'm grateful I have a good book, whatever it may be. Just practicing gratitude and thinking about things that you're grateful for in your life daily can really help turn your mindset around as well. And just for the sake of time, I'm gonna move on, but there are some Hygge activities during COVID that you can do. And the great thing about Hygge is that it is basically made for COVID. So when we're isolated at home, we don't have a lot of access to things that maybe we used to do, whether it was going out to dinner, things like that, seeing friends on a regular basis. So this is a way to be able to be present and create a really good environment at home so that you can kind of help to make you enjoy winter a little bit more and time during COVID. So things you can do is burning a candle or many, putting on comfortable clothes, indulging in comfort. That's another big part is soups and sweets. I know we talked about, making, if a red flag might be, you're eating starchy, sugary foods, but this is more doing it for intentionality and really being present and intentional about what you're eating. So if you are eating a comfort food, it's because you want to, it's not because you're just kind of grabbing it mindlessly. So that's something that they mention. Drinking warm beverages like tea, hot chocolate, reading a book without any background noise. Of course, I know a lot of us have kids, but as much as you can, not having like the TV music in the background. We talked about wrapping a blanket. So if you're going to go outside, doing a walk with your dog, a solo hike, or maybe it's a physically distanced hike with a friend, so being at a safe distance outside. And also decluttering your home, so being in a space at home so that you can feel that home is a good place to be instead of more stress. And staying connected during the pandemic. I know that the message is to be socially distant, and of course that's what we need to be doing. But I kind of want to change that mindset into being physically distant, so that we're not being socially distant, so that we are connecting to people socially during the pandemic, during this time. And it's so important to be able to do that right now because a lot of us are not feeling our best and want to go back to normal, and that's okay. But being able to talk to friends and family in a safe way is so important. So, things I want to kind of have you guys thinking about is how are you staying connected during the pandemic? You could play online games using apps or computer. There's a lot of I guess, systems that you can watch movies with friends and family, FaceTiming, have a regular Zoom party, things like that. Making sure you see your therapist regularly. I know a lot of therapists are offering Zoom meetings as well so that you can do that safely. Taking socially distanced walks, things like that. Just kind of thinking about how you guys are connecting socially during this time. More questions I want you guys to think about are what have been the most challenging parts of this pandemic for you? And what ways has your mental health been impacted? And what has been your biggest change day to day? So how has this changed your life? Maybe in a negative way, maybe in a positive way. But how has it impacted you? I want to definitely think about that and how that's impacted your mental health. So, as I said, I wanted to touch on how anxiety disorders, because anxiety and depression most of the time are linked together. It's hard to find one without the other. So, how has it been looking for these two disorders throughout COVID? So, more often than not, like I said, both are co occurring. And during the pandemic, understandably, the numbers have risen. So, as you can see in the corner here, in the left, it says that symptoms of anxiety disorder prior to COVID were about 8.2% in the United States. And now they're at about 28.2%. And then depression disorder is 6.6%, and now it has risen to 24.4%. And then the two together, people were experiencing it about 11%, and now it's raised, I think it says 33, but it's hard for me, sorry. It's hard to me to kind of see because the box is there, but I believe it says 33%. So obviously things have risen greatly because of the pandemic and other factors, of course. So what to look out for with anxiety, because like I said, many times it comes along with depression, are that social anxiety, so fear of social situations. And that could be simply because it's scary to go out of my house right now. Those racing thoughts of what will happen, what could happen, heart racing, chest pain, irritability. And due to the pandemic, people who may be experiencing anxiety and depression, obviously, as the statistics show, that it is worse for those people. So definitely, if you're one of those individuals, do not be afraid to ask for help. A lot of people are in the same boat as well. And then suicide, wanted to cover that as well. So the annual age for suicide is about, the suicide rate is about 13.42 per 100,000 people. And men die by suicide 3.57 times more often than women. And typically the age is men in their later years. So looking at men who are, so it's the highest rate of suicide is white men who I believe are 60, ages 60 through 80. So that's something to definitely look out for those of us who have older parents, just kind of things to watch for if you have individuals who are maybe more isolated because of the pandemic. I'm just reaching out to those people as well as much and as safely as you can. And on average, there are 123 suicides per day. And I don't know, this was pre-COVID, so I don't know what that statistic is right now with COVID, but I can imagine it might be higher than that because more people are staying at home, not able to connect to others, and feeling very isolated. And then I wanted to talk about suicide ideation during COVID, and if you are feeling this way, giving you some resources on what to do if that is how you're feeling. So on top of it being the prime season for seasonal affective disorder, there's also obviously there is a pandemic going on, and if you're feeling suicidal and having those thoughts, to reach out to a family member, a friend, someone you trust, and letting them know how you're feeling. And I wanted to mention too, a couple of resources below. Of course, you can always call 911, and then there's the National Prevention Suicide Hotline. And for those of us who maybe don't like to call crisis lines or it's intimidating to call someone, you can also use the Safe UT app and the crisis line. So they also have a phone number as well, but you can text people on the app as well. And I wanted to mention that just because you call a crisis line, that does not mean EMS is coming to your house and you're going to be sent to an inpatient psychiatric unit. It's also there for people who are struggling and just want to talk to someone for support. So I think it's important to wear that and hopefully make it a little less intimidating to do. And in Utah, we are lucky to have the free help for COVID-19 related stress. So they have a live hotline, so people who are trained and crisis workers who are trained to talk, and it's not just an automated, web of different automated voices. It's real people who are wanting to help. And they have that call and text line there, and it's 7 a.m. to 7 p.m. every day. As well. And so I think it's really important to be aware of that resource because a lot of us, again, we're struggling with COVID, whether we have mental health issues on top of that, that's a lot for someone to handle. is a free service. So if you are struggling with COVID and or depression or whatever it may be, this is a great resource to reach out. And that is all I have. So I want to thank you guys so much for talking to me and letting me, or I guess me talking to you and letting me talk to you guys about this. Just kind of bringing that awareness so that if any of you are struggling, that you do feel comfortable asking for help and know the symptoms and signs of what to look for. And of course, I am now open to answer any questions. So I will stop sharing so that I can kind of see that text box. Um, but if you have any questions, feel free to ask.
And thank you so much, Hannah, for offering all the resources and all the coping mechanisms as well. And I'm going to put one more in the chat box. It's our employee assistance program, Dear Oaks, that offers 24/7 assistance if you call the number in the chat, and they can help with a plethora of services as well.
Perfect. If I don't know if you guys have any questions for me, I'm happy to answer. If not, I hope you guys are all staying safe and are able to connect with your loved ones as much as you can during this time. I know it's been hard. Okay, perfect. Well, thank you again.
Thank you so much and have a
Thank you.
happy holiday season.
Yes, yes. Happy holidays to everyone. Thank you.